Coming up in the news, it's confirmed that Bimini resident who died Monday tested positive for COVID-19. There are 6 new cases in the country, and a man hauled before the court for attempted murder. The Bahamas Tonight, the Northern Edition, starts now.
This is the Bahamas Tonight, Northern Edition.
Good evening, Bahamas. I'm Shashina Wolf-Farquharson. As always, it is so great to have you with us. 21 cases, 1 death, and hundreds still in quarantine. Those are the latest statistics coming out of a press conference led by the nation's leader in the capital this afternoon. Prime Minister, the Most Honorable Dr. Hubert Minnis, noting that a surge is expected, and this is why it is important for residents throughout the Bahamas to take the emergency orders seriously.
We have already lost 1. In our population, that is 1 too many.
It was the news that the country anxiously anticipated but did not want to hear. The first death due to COVID-19 has now been confirmed by the nation's leader.
The COVID test on this particular individual has been positive. The family has been informed, and investigation and contact tracing has already commenced. We pray for the deceased and the individual's family members during this very difficult time.
The 51-year-old woman, Kim Roll, is said to have traveled recently, and health officials say contact tracing has begun in Bimini, and the healthcare facility will be sanitized to ensure that the health of personnel is not compromised. But during that press conference, even more disheartening news came, as the numbers of reported cases in the country have jumped from 15 to 21.
One of the new cases has a link to Grand Bahama. There are 1,500 diagnostic kits in our country today, and aggressive contact tracing continues. Health officials are following cases day by day. Through GIS mapping, we have identified hotspots on New Providence, and we have undertaken GIS mapping on Grand Bahama to identify hotspots there.
Speaking directly to the Family Islanders, the nation's chief pleading with those residents to take social distancing seriously.
The orders and the regulations we put in place apply also to the Family Islands. Those orders apply to the entire Bahamas. I am asking Family Island residents to stay at home, except for the exemption orders within our jurisdiction.
He also made this announcement.
There is to be no domestic travel within the country by plane or by boat. Be they boat by Bahamians who may claim to be fishing. Entering your shores may be devastating. Those who not abide by this may place other islands and keys and Bahamians in danger. They also take risk, and they risk being prosecuted.
Well, meantime, the nation's leader says as countries around the world have closed their borders, including the Bahamas, the financial impact of the coronavirus will be far-reaching.
We do not know how long this will last, but we do know that we will overcome this virus. As we had to assume great authority through the Emergency Powers Act, my government will have to make major changes in our economy. Tourism, which has carried us so well so long, is in a state of suspension due to this virus. And when it comes back, that is tourism, the Bahamas must be ready to welcome the world to our shores. However, no one knows when it will return.
Well, he says the good news is the government is already working on relief measures to assist Bahamians during this very difficult time.
These measures amount to tens of millions of dollars in various types of assistance. I urge everyone in need to make use of these initiatives that include food assistance, unemployment benefits, loans, tax credits, and deferrals. We will also shortly be making an announcement about rental assistance. To find ways to stimulate our economy now, and in order to create a master plan to rebuild our economy and to promote our social development, I will convene a high-level group of economic and other experts to provide concrete ideas and plans to the government of the Bahamas.
Well, frontline workers like health professionals are already faced with a great risk during this pandemic. Tonight, the nation's leader making amendments to the emergency order in an effort to protect those in the medical profession. With 21 cases of the coronavirus in the country, 1 death and hundreds in quarantine, healthcare officials have been working around the clock to stem the tide of this global pandemic. But during the government's latest press conference, the nation's leader telling the country as he expressed concern about the fact that more than 50 healthcare workers have been exposed to COVID-19.
If our healthcare workers continue to be compromised or removed out of the system, then that places great challenges to our health system. On behalf of all of us, I thank every healthcare worker throughout our country. I know firsthand what they are going through. I can speak from experience. I understand the stress and I understand the anxiety. But I want them to know that we will win this battle and that we are getting them every resource possible to win this fight.
As a medical doctor and a father of 2 physicians, the Prime Minister made this promise to healthcare workers across the country.
I will do everything in my power to protect the health and lives of our healthcare professionals and workers. Every healthcare professional fighting COVID-19 and protecting our general health are a part of the flesh and blood of our community. As Prime Minister, as a medical doctor, and as a father, it is my solemn duty to protect the flesh and blood and the well-being of our healthcare workers.
And with that, he announced the amendment of the emergency orders.
All private medical and dental practices shall eliminate all routine and non-emergency physical encounters with patients and shall, as best as possible, provide all routine and non-emergency services using virtual or remote means, excluding private renal dialysis facilities. And where physical interaction is a necessity, due to a medical emergency, there must be strict adherence to physical distancing and hygienic requirements.
But there are a few exceptions.
Pediatricians who are involved in the vaccination of our population, of our infants, and protecting our future generation is exempted from such orders. Vaccines must continue to be given so as to protect our future generation. Obstetricians who take care of our antenatal or pregnant mothers must be exempted because it is essential for them to continue to deliver excellent health care and to secure the safety of our unborn and soon to be born children. They must continue to provide the care to protect our future generation.
He says they are also seeking volunteers.
A volunteer hotline is being set up to register individuals who are interested in contributing to this fight against COVID-19, and we will soon provide more details on this.
The World Health Organization also deeply concerned about the rapid escalation and global spread of COVID-19 as we enter the fourth month since the deadly disease emerged in China. The WHO dashboard confirms worldwide some 827,000 cases, with some 40,777 confirmed deaths in 206 countries. Our Miko Knowles has more on a news briefing held this afternoon.
Director General of the World Health Organization, Dr. Tedros Ghebreyesus, says over the past 5 weeks, the organization has witnessed a near exponential growth in the number of new cases, reaching almost every country, territory, and area. He says the number of deaths has more than doubled in the past week, and in the next few days, there will be 1 million confirmed cases and 50,000 deaths worldwide.
3 months ago, we knew almost nothing about this virus. Collectively, we have learned an enormous amount, and every day we learn more. WHO is committed to serving all people everywhere with the best evidence to protect their health. WHO develops guidance based on the totality of evidence collected from around the world.
He says they are working hard with researchers all over the world to generate the evidence about which medicines are most effective for treating COVID-19. In addition, he says there has been an extraordinary response to the call for countries to join the Solidarity Trial, which is comparing 4 drugs and drug combinations.
So far, 74 countries have either joined the trial or are in the process of joining. As of this morning, more than 200 patients had been randomly assigned to one of the study arms. Each new patient who joins the trial gets us one step closer to knowing which drugs work. We're also continuing to study the evidence about the use of masks. WHO's priority is that frontline health workers are able to access essential personal protective equipment, including medical masks and respirators. That's why we're continuing to work with governments and manufacturers to step up the production and distribution of personal protective equipment, including masks.
Dr. Ghebreyesus notes that there is an ongoing debate about the use of masks at the community level, and the World Health Organization recommends the use of medical masks for people who are sick and those caring for them. However, in these circumstances, he says masks are only effective when combined with other protective measures.
WHO continues to gather all available evidence and continues to evaluate the potential use of masks more broadly to control COVID-19 transmission at the community level. This is still a very new virus, and we're learning all the time. As the pandemic evolves, so does the evidence, and so does our advice. But what doesn't change is WHO's commitment to protecting the health of all people based on the best science without fear or favor.
Rumiko Knowles, ZNS Network News.
Meantime, the Bahamas Mortgage Corporation offering a 3-month loan deferral to its customers who are impacted by COVID-19. Managing Director Phil Haven confirmed that only mortgage clients whose accounts are current and up to date can sign up for this initiative. Now that mortgage payments will resume with accrued interest at the end of the 3-month period. However, Haven noted that the corporation always finds a way to assist its clients when necessary. And coming up, more fallout from the COVID-19 pandemic as another group of workers are sent to the unemployment line. That story and more when we return.